Greetings. My name is Wala Saadi, and I am currently an assistant professor at Lahore University of Management Sciences in Pakistan. Today, I'll be talking about my research titled as Biomedical Integrated Circuit Design. This is a brief outline of my talk. I'll discuss my research area and interest, my current research projects, and my future research plan, and how I will contribute to the research activities at Curtin. To summarize, my research focuses on developing wearable devices for home monitoring, human gait and motion analysis, and hospital support by providing portable medical devices and point-of-care applications. So in summary, my research focuses on next generation of biomedical systems. Chronic diseases are basically still the leading cause of death worldwide. And how can we solve or mitigate this issue? My research aims to develop early detection solution by providing biomedical devices that allow continuous monitoring and help the patient to get better outcome, whether they are suffering from cardiovascular diseases, neurological disorders, or even cancer. We can contribute to find a solution for that. My research project focuses on these chronic diseases. So the first example is non-invasive glucose monitoring, where basically I worked on developing a PPG-based solution for measuring the glucose level non-invasive way. We have very good results with high accuracy of predicting the glucose level. This project was funded by Higher Education Commission in Pakistan, and we have got several research publications for this project. We aim to further improve the algorithm by providing more patient data for training our system. The other project involves monitoring the depth of anesthesia from EEG signal. So in this project, we have measured and recorded EEG data from different patients in the local hospital, the children's hospital, and we have developed an algorithm to monitor the depth of anesthesia. We have gotten also excellent result and accuracy of 95%. We have several collaborators on this project. So we have collaborators from Germany, local hospital here, and industry for developing anesthesia machines here in Pakistan. And this project is funded from Higher Education Commission also in Pakistan with a fund of $120,000. We have also several publications for this work, and still the newer version is under review for ISCAS conference in 2022. Another project where I am currently working is home monitoring for COVID patients and beyond. So the current situation where we, in the pandemic, most of the patients who require treatment, they were in the hospital. But the ones who were at home, they did not have a proper means for monitoring their symptoms, how they are progressing, and when they should go to the hospital. So for that, we are developing a continuous monitoring device that's going to measure the heart rate variability, blood pressure, temperature, SpO2, and respiratory rate, and it should communicate those vital signs to the healthcare provider and alarm the patient when they should visit the hospital. So this project is currently funded from the Islamic Development Bank. And this was a very competitive grant, but successfully I won this grant, and it's currently in execution, the project. We have also submitted 3 conference papers for review in ISCAS conference. We have also collaborators from industry and academia on this project. So to summarize my research outcome for my tenure here at LUMS, I have published several IEEE conferences and journals to summarize my research findings for my projects. My future projects where I aim to continue working or improve what versions of work we have done. So I aim to continue working on the vitals monitoring. Additionally, I want to work on biosensors and point of care applications that basically provide fast detection for several analytes in the patient's body. So it allows better disease detection and monitoring, and it monitor as well as that the progress of a treatment. So the biosensors, they are very important for point of care applications and allows the conversion from a biomedical signal into some electrical signal that we can measure and quantify. And for that, basically, I aim to develop accurate and low energy readout circuits that allows measuring these signals very efficiently. I have started working on this project, and we have a conference paper published, and an extended version of it is currently under review in IEEE Transaction of Biomedical Circuit and System. Another area where I also want to continue working and expand my research in the field of artificial intelligence for healthcare. So basically, the AI is used in very wide range of applications, and among them is the healthcare. So it allows us to reveal healthcare conditions or abnormal conditions lying in extensive amount of data. So it helps to detect diseases, including cardiovascular diseases and neurological disorder and even cancer. So I aim to develop non-invasive and innovative tools that utilize AI algorithms for accurate disease detection. And I aim to realize these algorithms on a wearable devices to allow the patient home monitoring, and they don't need to go to the doctor to keep an eye on their disease progression. So how will I contribute to the research activities at Curtin? I find a great research is ongoing in Curtin, and I hope to contribute in the digital system and intelligent sensor group by providing personalized healthcare and biosensors for point of care application. The signal processing group also can be a good fit for me to continue working on biomedical signal processing, as well as the Center of Excellence in Artificial Intelligence, where I can also aim to excel in developing innovative algorithms for disease detection and prediction as well. How will I fund my research activities? I have looked for several possible research funding agencies, including the Australian Research Council, Department of Industry, Science and Energy and Resources, that basically funds projects that they are involves industrial partner, and several of my research projects already here that is funded in Pakistan, they are also with industry. So I think I can also continue in this direction. Department of Health, also an important collaborator for me is the hospital, where basically we need the doctor inputs on these devices. We need also to test our biomedical devices on real patients, and the hospitals is an important collaborator in this. There are also a couple of international funds that I can target, not limited to Semiconductor Research Corporation, SRC, where basically funded my PhD studies in Masdar Institute of Science and Technology in Abu Dhabi. The list is not full. I mean, I can definitely look for other resources as well. Where I will plan to publish my work, I don't compromise on the quality. Quality of publication is very important for me, and I continue to publish in the top forums, including IEEE Transactions. The main one for me is Biomedical Circuits and System, IEEE Sensors Journal, and IEEE Biomedical Circuit and System Conference, ISCAS, and many other forums. So in summary, my research envisions developing a biomedical circuit and system design center. I aim to solve the real-life health and beyond challenges. I aim to equip the next generation of engineers with the motivation and the skills to continue working on this field. Thank you for listening for my talk.